Welcome back to Primetime News and a special welcome to the viewers on onespotmedia.com. Up first this evening, should schools reopen tomorrow in light of the rise in COVID-19 cases? That matter is being raised this evening as the Ministry of Health continues to report a surge in new coronavirus infections. President of the Medical Association of Jamaica, Dr. Brian James, says his association will meet to further discuss the issue, but he doesn't think it is a good idea for students to return to school at this time. Increase in the number of people hospitalized with COVID, increase in the positivity rate and the number of confirmed cases. The Medical Association of Jamaica says there can be no doubt that the country is now experiencing the fourth wave.
I haven't been able to find an official definition of the start of a wave, but if this isn't, then no wave. We haven't had any wave.
Come tomorrow, thousands of students from 856 schools will return to the physical classroom. In a bulletin to the principals of all public and private schools last month, the Education Ministry said large primary and high schools must use the blended approach to classes. President of the MAJ, Dr. Brian James, says the association is still discussing matters relating to the reopening of schools.
We remain a bit ambivalent about it. It is clear to me, just personally, that it wouldn't be it wouldn't work very well for us to open schools on Monday. If the positivity remains as is, if the numbers are so high, then COVID is going to disrupt the schools anyway.
He further argues that it is not the best decision to reopen schools with a positivity rate above 30%.
That is not a good idea, I do not believe, personally. But we are having discussions as we speak within MAJ to hear all of the contending views, and we're going to put out a position by tomorrow. Today's Sunday, by tomorrow, we're going to put out a position on it.
In the meantime, the MAJ president says there are some things that must happen now, like a review of the restrictions in place to see if more stringent ones are needed. He also wants hospital systems to be strengthened to ensure that they can adequately respond to any further increase in hospitalization.
And that would involve taking care of the staff. The staff really was one of the big casualties of all of the waves so far. And what we are seeing already over the past week is that there is a massive increase in the number of members of staff who are either quarantined because they are exposed or are actually isolated because they've tested positive, a very large number of those. So what we have to do is have a look again at our isolation policy and see whether or not in the face of the asymptomatic disease, whether we can make some changes to the number of days that people are isolated for or are in quarantine for in the current circumstances.
And the Jamaica Teachers Association is urging the government to ensure that the resumption of face-to-face classes is guided by the Ministry of Health. In his New Year's message today, JTA President Winston Smith said it is important that the science guide the decision-making in light of the expected fourth wave and the spread of the Omicron variant. Mr. Smith also said teachers at all levels of the education sector are expecting the long-promised laptops to carry out their duties in the new year. Now, as we said, the Ministry of Health continues to report a surge in new COVID-19 infections in Jamaica. In its latest update, the ministry said 528 new cases were recorded on Saturday from 1,569 samples. This brings the overall case count to 95,177. The positivity rate now stands at 34.9%. No new deaths were confirmed on Saturday. The death toll remains at 2,476. Another 19 persons have been hospitalized with COVID in Jamaica, increasing admissions to 123. 12 of the patients are severely ill, while 4 are critically ill. 131 more persons have also recovered from the virus, increasing the recovery count to 65,813. There are now 2,496 active cases of COVID on the island. Now 566,889 people are now fully vaccinated against the virus.